All right, so all your class recordings are gonna be here. So, um, now it takes a little time sometimes for me to get the recordings because Schoology, if y'all remember from last year, Schoology does not cooperate with anything really but YouTube. Like you can't really, it's not gonna show. So I have to download my Loom, then I have to upload it to YouTube, then I have to get the link and put it in here. So sometimes it might be, a lot of times I'll do it when I get home. But it'll be done. It'll probably be done by the end of today. Um, thank you. You're welcome. It'll probably be done by the end of today because we got a staff meeting, so I'll probably stay to listen to that after school. So it'll be here, like all the recording. So if you miss a day, they're here. Also, that's your Google site that I showed you at the beginning of the school year. It's all your information and stuff. So it has your Mind code and Google Classroom code. Still keep the Google Classroom just in case Schoology's messing up, or that'll be our backup if I need to give y'all work. Also another place for y'all's agendas and bell ringers are here. So I try to do an agenda of what we're gonna do for the day. Sometimes it's like if you miss, you know, sometimes it's accurate because sometimes we got stuff going on, we don't get to everything. But that's what I plan on doing. And then these are your bell ringers for all the classes. They're here as well. All right, then you got the AS website link. You got your bell ringers. You got your agenda there, and then you have your folders. I haven't made y'all a makeup work folder, but if you missed last week when I did the BLS quiz, I put it in here and I linked the 5 people. I think I had 3 people that's taking it. I got 2 more that haven't taken it, but I linked it right here. So if you haven't taken that quiz, it's in week 6. These are the notes right there. And also, if you want to look at the recording before, we took it, when did I take it? Last Thursday? Last Friday? Friday, I think. So that's that quiz. I am gonna make a makeup folder. And then it'll look, cause I'll just show y'all another one of my classes that I got a folder. And so I just got a makeup folder. So if you're absent or you had to quarantine, and I'll just put what you need in here, and then I'll just when it says 17, I mean I got 17 people that haven't taken this quiz in that class. Got 11 people that haven't taken their test. So I just link, if I go in the grade book, see you missing stuff, I'll just link it there and attach it to you. Cause I can directly assign it to like certain students. So I'm not gonna give it to everybody because people start getting confused. They start trying to turn stuff in and already turned in. So I'll just directly link it to whoever. Do y'all have any questions about Schoology or where something is or anything like that? Okay. Kind of self-explanatory. Okay. All right. So we're gonna look at what I think, because we end of the 9 week is the 15th, so we got basically a little over 2 weeks left. Yes. So we got a little over 2 weeks left. That week we got, I know 10th graders supposed to test for the pre-ACT. They initially said 12th graders gonna test that week, but I think they've changed it. But I'm gonna find it out in my staff meeting for sure today. So, but we know in or not week is the 15th. So y'all need 2 more major grades, and I don't know how many minor grades. I remember. So I know 1 major grade is gonna be because you gotta take the BLS written test. That's part of getting your CPR card. So it's gonna be a written test, and then figure out what the second one is gonna be. I think it's gonna have something to do with what we do today, probably. It's probably gonna be, we're gonna do what's it called? Oh, I thought I pulled this up. It's going to be team dynamics. So we're gonna look at like how a team works in the CPR. Why is this thing tripping? Okay. Because we've gone over, we've done adult, we've done AED and back, and I'm gonna order another AED so y'all can get like practice with it because I don't know what I did on my other one. I can't find it. And then we went over 2-person mouth to mouth rescue breathing, talk about that. So we're gonna look at high performance teams, like team dynamics, how everybody has a role, and then probably a major grade, which I'm probably gonna let y'all do it on Thursday. Cause y'all gonna have to like act out like a scenario. And that's probably gonna be huh? No, it's a team, so it's gonna be all y'all. Like maybe 5 or 6 of y'all go, and 5 or 6 of y'all like that. But each person gonna have a role. That's what I think is gonna be like another major grade. Huh? You won't even talk. You want to be the talker. Talker? What's that?
Gotta know what they're supposed to do.
Oh my God.
The speakers?
Of course you want to be in control. All right, let's see. So this is a video. It's I think it's gonna show like team dynamics. Let me see. Is my volume up?
A high-performing team achieves specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials, or ROC trials, showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, you may notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle. When using an AED, the prompts will instruct you when to pause, for example, during rhythm analysis or shock delivery.
Switch compressors with the second compressor coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
3, 2, 1, switch.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course.
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both the what and the how flawlessly. That requires practice, and effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type of program, talk to your instructor.
Alright, so these will be, okay, I think what we're gonna do as far as like for it to be a major grade, we'll go over it, but I need to make a rubric and all that stuff. So it's gonna be a team, like you're gonna get a scenario, and then y'all have to act it out. So that means somebody has to be the team leader, which is I think what tonight's session want to be. But team leader, you got to know everybody's roles, so you can't just be. You got to know what's going on. So team leader, you got somebody that's gonna be the compressor, got somebody that's gonna do the airway, somebody that administer medications. In a hospital setting, you'll have somebody that's administer medications, but so you're gonna have to like fake it. A monitor, defibrillator, or CPR coach, that's the person that's doing the CPR, doing the AED, and then you have a timer recorder. When we're actually having a code in a hospital, we have somebody that's writing, because you have to, like, at the end of the code, once it's called, whether they make it or not, we have to fill out this code sheet. So we have to tell what medicine we gave, what time it was given, all that stuff. So somebody actually writes down, like, because like some medicines we have to give like every 2 minutes, or some medicines you have to alternate. You give atropine, you give epinephrine, like that. So some of these things you are gonna have to like just act in the roles, especially like this one and this one. But you're all gonna be working together. You're all gonna be working together, as a team. But we'll talk about it. I think we probably won't do it till Monday. Y'all come back here Monday, right? Yes. So Monday. So I'm gonna let y'all practice Thursday. Practice it with getting y'all groups. Y'all can pick. I think y'all got 14 people in here. So let y'all practice once I get the rubric made up. I got one somewhere because we've done this before in other classes. But this is gonna be a major grade, so y'all probably just wanna do it on Monday. We'll let y'all like go through the steps and kind of practice it on Thursday, so y'all be ready for it on Monday. And cause I wanna I'm gonna order AED out Amazon, so I wanna make sure it's here, so y'all can actually use one that's gonna work right. Unless I find my other one between now and then. That's why you running. No, I thought it was an emergency or something happened. She running out of here. Oh no, I don't work for Mercy. Just for food. I'm just not all innocent.
The ideal situation for performing BLS is having a team with multiple rescuers who can perform all needed roles.
Your team will be asked to treat a cardiac arrest victim. Your instructor will read a scenario and assign a role to each of you. These roles include team leader, compressor, airway, medications, monitor defibrillator, and timer recorder. Some team members may be assigned multiple roles. This scenario will run for 10 minutes with the goal of providing high-quality CPR and enforcing the principles of highly effective teams. This exercise is purely practice and not a test. The exercise will, however, reinforce skills performance and improve the overall resuscitation provided to the patient.
To evaluate the resuscitation, your instructor will be looking for high-quality CPR, which includes compressing at least 2 inches or 5 centimeters on an adult victim at a rate of 100 to 120 per minute, allowing complete chest recoil between compressions and avoiding excessive ventilation. Another critical component of high-quality CPR is minimizing pauses in compressions. So your instructor will be measuring chest compression fraction, or CCF.
CCF is the proportion of time during a resuscitation attempt when the patient is receiving chest compressions. Fewer interruptions are associated with increased ROSC and increased likelihood of survival to hospital discharge. Targeting a high CCF is desirable for survival outcomes. A chest compression fraction of at least 60% is recommended, and a goal of 80% is often achievable with good teamwork. At the end of the exercise, your instructor will conduct a debriefing session to determine where improvements could be made in future attempts.
Alright, so I think y'all are not gonna know what the scenario is beforehand, because like cardiac arrests aren't planned. It's kind of like, just happen. So I think I'm just gonna come up with some scenarios. Let y'all pick one or draw one, and then I'll read it to y'all, and then y'all have to go. So first thing, okay, so if you have a patient that's in cardiac arrest, what's the first thing you're gonna do?
It was on the quiz, y'all.
What's the first thing you do?
Okay, you answer it then.
Give me answer
Check
choices.
the
Oh,
call for help.
No. First thing you do?
Strip the person.
No.
Put into the
Oh my God.
Put into
Oh, your patient dead. Oh, he dead. He get out.
Are you
check the pulse.
Are you okay? Are you okay?
No, what you do for that? Nope.
Run over to them.
Check your surroundings.
Yes. Why? Why do you check your surroundings?
Oh, because it can be like a dangerous place.
Yes, and then both of y'all gonna be in trouble. Yes. So you gonna assess the scene or check your surroundings. Then what you gonna do?
You walk up, you run up to them, check their pulse. Ask them are they okay. Well, no, you ask them are they okay, then you check their pulse.
You ask them are they okay?
And then you strip them after you check their
Why
pulse.
you wanna strip people? What you stripping? You talking like they fully naked. You just need to get to the chest.
Yeah, that's what I'm saying.
You saying strip, like all that clothes
You
coming
start
out.
doing compression.
So you assess your scene, you tap and shout,
Yeah.
you
Check this one.
check their pulse for how long? No longer than what? No longer than 10 seconds. While you checking the pulse, what else are you doing? Checking the pulse at the same time you are. Patient dead. Oh, y'all patient dead. Why you checking the pulse? What else are you doing at the same time?
The mouth thing.
Oh, you watching their chest and see they breathing.
You got to see they breathing. Cause they might not have a pulse. They might be having, they might be breathing a little bit. Normally they ain't got no pulse in the breathing. If it's some, it's gonna go away. So if they got a pulse, but they're not breathing, what do you do?
Start to perform CPR? No. Check they got a pulse.
They got a pulse, but they're not breathing. Nope. Yes. If they got a pulse, do not do chest compression, because they gonna probably gonna punch you.
I'm gonna say that.
I would. If my heart beating and you beating on my chest, I'm gonna be beating on your face. Do not do any chest compression on somebody with a pulse.
You do the little mouth to mouth.
You do rescue breathing. So you do rescue breathing. Okay, so if they don't have a pulse, then what?
Chest compression.
You start with chest compressions. How many?
30.
30. Then
2 breaths.
2 breaths.
And then you start that.
30 to 2. That's your cycle. Okay, so well, before you actually started compression, what do you do? What you need? What's it? A shot thing? What is it? I'm like, I gotta go get that shot thing. She gonna be like, what?
That's
You
what
need
it's
an AED?
called. That's what most people call
No, I'm gonna need y'all to know what it's called.
it. But you can't have no short definition to like.
AED, how short you want it? Unless you want me to say, can you please go and get me the automated center defibrillator? And then you're really gonna be confused. You're gonna be like, the what? Just say AED. If you say AED because them letters are big, anywhere you see AED, it's gonna have big letters that say AED. So they gonna know what that is. They might not know what to do with it, but they gonna know where it is. So you call somebody to get the AED. If you're by yourself, you're gonna start chest compressions, 2 breaths. Okay, so once they get the AED, what you supposed to do?
Turn the paddle.
What
Turn
paddle?
it on.
First thing you're gonna do is turn it on. Why?
Because it needs to be turned on.
It need to be turned on, but why?
It tell you
It tell you what to do. So it's dummy proof. If you turn it on, it's going to direct you. So if they're working on, you're doing compressions, they're working on the getting AED together. So should you stop compression?
Not unless it tells you to.
Not unless it tells you to. So you're doing compressions, they have to work around you, right? They're working around you. They're putting the pads on and whatever it's telling them to do. Okay, so when should you stop compression?
When it's looking for
Analyzing, looking for a rhythm. What rhythm is it looking for to stop? I forgot. What's the 2 rhythms? What? Did y'all write them down the other day? Y'all write them down on y'all
I think I
flowchart?
did.
You said 2 rhythms. That Beyonce song.
No, man. What?
Oh, what she talking about?
Just say
What she talking about?
V-fib and
V-Tech.
ventricular fibrillation or V-fib and ventricular tachycardia.
Oh.
Those 2. Which one you don't shock for?
Was it
What's the one that
We
you
didn't
don't
write
shock
that down.
Yes, we did.
for? What's it called? Those one are A. Asystole.
I was just gonna say
No,
that.
you
Yeah,
didn't.
you
Oh,
were.
God,
Yeah, I knew
I
it.
knew it.
You must say what?
Later, but you could have corrected me. I swear I was
Asystole. So the AED is looking for a rhythm. That's what it's going to do because it wants to shock. If it picks up the rhythm of ventricular fibrillation or ventricular tachycardia, then it's going to shock. If it picks up asystole, what else is asystole? What else
We didn't write that.
do you call it?
dead,
But
flatline.
flatline. It's not going to shock. So you'll just continue with CPR. Alright, so if it says analyze the heart rhythm, shock advised, what you gonna do? What you gonna say?
Clear.
Clear. And what needs to happen?
Everybody need to
move back. Why?
Because
Because you might be on the floor if you get shot. And then we got 2 patients to deal with. So before you hit that shock button, because this is what I'm gonna be looking for.
So when
Because somebody gonna hit shock and everybody not clear.
Clear.
You gotta say, but when you
so
say
the team leader
clear,
gotta say that.
no, the person that's actually working the AD has to say clear. So they're the one that's gonna be hitting the button. So they have to say clear, everybody clear. Everybody needs to stand back. Of course, I would not bring anything that's gonna shock y'all here, but this is for practice and training purposes. You need to clear. So once it clears, it delivers the shock, now what? What you do? Start back compression. But after the shock, what could one person be doing after the shock? Feeling for a pulse. Because you know it's shocking. It's shocking to try to put that heart back into a normal rhythm, which means with a pulse. So you can check for the pulse. Okay, how often should you switch compressor and breather? Every 2 minutes or 5 cycles of what? What's the cycles of? Compressions to breath. So 5:30 to 2, it should equal about 2 minutes. You can switch. Because why? Why should you switch?
Cause you get tired.
You get tired. Cause y'all about fell out the other day, and y'all ain't do but 3 cycles. Yes, y'all was huffing and puffing. Yes, y'all was.
I thought we did more than 3.
Y'all did 3. Talked about a little bit. I said, do y'all want to do it now? No. Okay, we doing it again. Then we did it again.
Yeah, we did it 3 times. Then we did it another 3 times.
Yeah, I want y'all to feel the burn.
What you did? This ain't no gym.
Hey, you don't look like you know what the inside of a gym look like.
I do.
The compression should have been nothing for you. This ain't no gym. All she wants to wake up on that part. All right, y'all line up for lunch.
What you'll learn. What you'll learn.
All right, so we're going to talk about pediatric BLS. We're going to talk about age definition for infants and children. So these are the questions that I asked y'all for the bell ringer, just to see what y'all know. Describe causes of cardiac arrest in infants and children and the steps in the pediatric chain of survival.
Age definition.
All right, so pediatrics is a branch of medicine that involves medical care of infants, children, and adolescents. Pediatric BLS should be used on infants and children. An infant is defined as someone less than 1
Pediatric
year of age. A child is defined as someone between the age of 1 and the onset of puberty. So that's what we talked about in the bell ringer. So if they're 1 or less, so like 9 months, 10 months, 2 months, that's considered an infant. Anybody from 1 till puberty is a child. So puberty means they have breast development in girls and underarm hair development in boys. So these developments typically occur between 12 and 14 years of age. Now kids are coming younger with boobs and all this stuff. All right, and I don't be ready for it. When my kids go through it, I'll be looking crazy. All right, so pediatric BLS should not be used on adolescents. And adolescents is someone between the onset of puberty and adulthood. So that is y'all. People are considered legal adults when they reach a specifically defined age, such as 18 or 19 years old.
Causes.
All right, so causes of cardiac arrest. So remember I said with children, normally heart disease or heart problems is not the cause for cardiac arrest. In adults it is. So cardiac arrest due to heart disease is uncommon in infants and children. However, cardiac arrest is often a secondary effect of shock or respiratory failure from causes such as asthma, choking, or drowning. So asthma, choking, and drowning are things like, so if somebody's choking, which we'll go over how to do choking later on. That's like if somebody is choking, can't get the obstruction out, they go into cardiac arrest. That's normally one of the reasons kids go into cardiac arrest. I don't know if y'all ever seen those videos of people doing like having a baby that's choking and they're like doing all the wrong things, but you know, shaking them and shaking them upside down.
Police officer put the baby on his hand and just turned over and just started.
That's correct. That's correct. Y'all learn that too. All right, in pediatric BLS, what is the age range for a child?
Between 1 and the onset of puberty.
Between 1 and the onset of puberty. Heart disease is usually the cause of cardiac arrest in infants and children. That's false. It's going to be secondary to something. I mean, it's going to be another issue that's going to cause them to go into cardiac arrest. Not that they... Now, some kids do have, like, they're born with heart problems, but these are, you know, they're not talking about those. Huh? Sickle cell, not your heart. That's your blood cells. No, our blood cells are round. Sickle cell is when the cells are like shaped like long, like a sickle. They call it a sickle shape.
Popsicle. Pediatric chain of
Alright, so remember we talked about chain of survival with adults. So now we have one with the pediatric population. But the first one is going to differ. Well, we had activate emergency response with adults. The first step is going to be prevention. And then it's going to go through the same steps we had with pediatric, we had with adults. So the AHA created a pediatric chain of survival to illustrate important steps to take during cardiac arrest in infants and children. Because cardiac arrest in infants and children is usually a result of non-disease related causes such as respiratory illness, a prevention link was added to the chain of survival. Like the adult chain of survival, the out-of-hospital steps should be implemented as quickly as possible. So these are the links. You have prevention, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and then recovery. So it looks just like adult, and so we have that one step in the beginning, which is prevention. We want to prevent any of this from happening. So that's why, like, you got for like infants and stuff, you don't want them choking, so you keep stuff out of their reach, and because little babies, they put stuff in their mouth, everything goes in their mouth, because they're learning. So what's the first step in the pediatric chain of survival? Prevention. All right. Link 1. Prevention.
Activation of emergency response. High quality CPR. Advanced resuscitation. Post cardiac arrest care. And recovery.
Right. So same thing as we did with the adults, is just prevention is going to be the first step.
The foundation.
All right. So, foundation of pediatric BLS includes the activation of the emergency response system and then high quality CPR. Healthcare providers must learn the techniques of pediatric BLS so that they can act quickly and correctly in emergencies involving infants and children.
Foundation.
All right, just like with adult BLS, rescuers need to have a strong foundation in the following areas. So you got to have critical thinking, problem solving, communication, and teamwork. Because things just don't go like textbook. Like this is what happens, and it's always gonna be some little monkey wrench that's gonna get thrown in the middle of everything. So you got to have critical thinking skills. So if this happens, then what do I do next? You never know. Something always happens. Problem solving. Be able to, if you come into a problem, you gotta be able to solve it. Communicating with, your people that's standing by, or also people, your coworkers, family members. You gotta be able to communicate and then have teamwork, which y'all will practice.
Lesson summary.
All right. So 1 person pediatric rescue.
What you'll learn.
What's the chest compression rate for 1 person pediatric? 30 to 2. So across the board, everybody 1 person is 30 to 2. All right. So this is the flow chart that I gave y'all previously. So procedure for BLS. First step, you're gonna verify the scene. You're gonna check for responsiveness. Gonna check pulse and breathing. Y'all start stuttering when I asked y'all this earlier. Pulse and breathing at the same time. So you're checking for your pulse and checking for your breathing. Depending on what's happening, you're gonna do something different. So if they have a pulse and normal breathing, you're just gonna put them in a recovery position. Pulse but no normal breathing, you're gonna give rescue breath. Pulse and no normal breathing. Let's say pulse and no normal breathing. If it's witnessed, if you witnessed it, you're gonna activate emergency response. If you didn't witness it, you're gonna perform high quality CPR. So what that means is when you have a pediatric patient, also infant. So say go in the mall, walk in the bathroom and go to the restroom. A little kid, maybe about 5, is on the floor alone. Maybe might have passed mama in the, walking in the floor alone. No, not
I'm
sleep.
saying like,
Well, down there. Okay. I'm just walking in, right? I didn't witness it. I don't know what happened prior to me walking in. So if I come in, kid on the ground, I'm gonna go ahead and I'm gonna get started, right? If I'm with a kid, say it's my child, my 9-year-old, she's a child, 9-year-old, we're walking or whatever, she collapses. I can go ahead, because I witnessed it, I'm gonna activate the emergency response system first. If I don't witness it, I walk in the bathroom and somebody's on the ground, I'm gonna go ahead and do 2 minutes or 5 cycles of high quality CPR first, then I'm gonna call. If I witness it, I can go ahead and call, and then I can do my CPR. But nowadays, it's 2021, everybody got a phone, just whip your phone out, and you get started either way. But this is what it's saying. If you witness it, you can go ahead and call somebody else for help. If you don't witness it, you have no idea, because remember, the longer you're down without nothing, what happens?
but how you know that?
Huh?
How you know how long he been down?
That's what I'm saying. You don't. So the longer the longer nothing's happening, what's going on?
They're not breathing.
Not breathing. So if you're not breathing, your heart's not pumping, what's not going on? What's not getting anywhere? Blood and oxygen to your brain. Nothing is happening. So remember, when we first started talking about CPR, after 4 minutes, their brain started getting affected. I don't know how long they've been down, so I need to get my chest compressions going, so maybe something will start flowing, because I don't know. I witnessed it. If she just falls, she looking like she ain't breathing or whatever, I can call somebody. But you got phones, I say just whip it out. Go ahead and dial, put it on speaker, and you start with your CPR. But that's what that means. This is the difference we don't have this right here in the adult one. So that's the difference. In the pediatric one and the infant one, if it's witnessed, you can go ahead and activate EMS. If it's not witnessed, if you have no clue how long they've been down, then you need to go ahead and start doing something. All right. So if you witness a collapse, no, you're going to perform high quality CPR. If you witness it, yes, you're going to activate the emergency response system, if not already done, and get an AD. All right. So you're going to attempt pediatric defibrillation. We have a shockable rhythm. We're going to deliver a shock and resume CPR until the AD is ready for another rhythm check. How often did I tell y'all that it checks the rhythm? I remember? How often do you switch?
2 minutes.
So how long does it take for it to check another rhythm? 2 minutes. That's normally when they get ready to deliver a shock, everybody gonna start switching in, because it's about 2 minutes. So you'll continue your advanced life support until somebody gets it, if it's a shockable rhythm. If it's not shockable, of course we know it's not gonna deliver a shock. Need to still do CPR. Let the AD do what it does, and then continue. So remember, when do you stop compressions? Not just because, not when you're doing the AD, but actually when do you stop doing CPR? Remember we have reasons why we stop doing CPR?
When help arrives.
When more people come in, that's going to take over. They show signs of return of spontaneous circulation, meaning they have a pulse. Because remember, somebody got a pulse. Don't be doing no chest compression. They're gonna chest compression your face. Don't do that. They might be a little weak, but don't do that. So if they got a pulse, they start coughing, they start moving, breathing. Somebody bring a DNR order in, do not resuscitate. Like I told y'all, it used to happen at the hospital all the time. We get these little old people in from the nursing home in cardiac arrest. Well, until we actually know that they are do not resuscitate, we have to do CPR. That was all the reasons. So for the most part, this is similar to what we do for an adult. It's just when you get right here, if you saw it happen or not, that's where it changes.
Personal protective equipment.
So everybody knows about PPE. You know, you're supposed to wear it. Like I told y'all, mouth to mouth, don't worry about it. If you don't have any kind of barrier devices or mask, just do chest compressions. Use your AED until somebody with all the equipment gets there. If you're somewhere that's, like a facility that has all these things.
Step 1.
We did this already. Yep.
Step 2.
We know how to tap and shout.
Step 3.
So we'll get one of my little people over here.
1. Make sure the victim is in the supine position. Open their airway using the head tilt chin lift technique. When performing this technique, the child's head should be slightly past neutral with a slight flex in the neck. For an infant, the head should be in a neutral position. If spinal trauma is suspected, use the jaw thrust technique.
Alright, so first thing you do is what?
Check the patient. I'm gonna make sure the scene clear.
Yes. Assess the scene. So I see a patient now, I'm looking around, making sure like there's no active shooters, there's no fire, no fighting or whatever.
What if it is though?
Then you gonna back away. And you gonna call 911, be like, hey, they shooting somebody down. Gonna help, but it's a lot going on.
You just leave.
You wanna be dead? I mean, you wanna help, but sometimes you just can't. Like, I'm not finna walk in no crazy situation now. Now, they fighting over here and they down, then I'll probably come over here, but if they in the middle of it, Alright, so you assess the scene and what?
You okay?
Tap and shout. Are you okay? Are you okay? They might not answer you. They might answer you. So that's how you going. You checking for what?
To see if they still breathing.
What you checking for?
Or see they still alive.
No.
What you doing there?
Well, I'm asking you.
I'm saying like you said.
You checking for what?
To see if they okay?
Okay, but what are you checking to see if they do what? Respond. Cause they might just be down there. Who knows? They might be what they do. I don't know.
That's what you're doing though when you said sir, so you checking to see if they alive. That's what I would think. Like you responding, you basically.
I guess, but we're checking to see if they respond. Like, they might be, just drunk. Who knows? They just fell, tripped over the air, and just fell on the floor, and they down there, hit the head, but they, So you want to check to see if you're in movement. All right, no movement. Then what you do?
Check for a pulse.
Gonna check for the pulse. You're gonna feel for the pulse. While you feeling for the pulse, what are you doing?
Watching to see if their chest.
I'm looking to see if I got a chest movement. Checking for a pulse. No movement. No chest movement. No pulse in the carotid artery. Then what?
Start your
Call for help.
Call. Hey, somebody get the AD. And then what? First you gotta make sure they get to that chest, strip them, as I said. Strip them. You making sure that you got a bare chest. They need to be laying how?
Flat on a hard surface.
What's the word for that? On their back.
Supine.
Supine.
Oh.
Supine on the spine. I remember that.
Supine on the spine.
I mean they laying on their
spine position.
Just your spine back here. So supine, face up, supine. So you're gonna start with chest compression. So where you put your hand?
On the bottom of their
upper
the lower part.
What is this?
Of the chest bone.
What's it called?
The sternum.
Sternum. Y'all got to use y'all medical words so people think y'all know what y'all talking about. Everybody know what breastbone is. You mess them up when you say the lower half of your sternum. They're gonna be like,
Oh, she's smart.
Yes. Probably gonna mess them up. So lower half of your sternum. So you're gonna push. Alright, so how should your hands be? How should your arms be?
Straight.
Straight. You don't need to be, this is not it. Cause first of all, you ain't doing this.
You put no power.
No. So arms should be straight. Shoulders, which is gonna be hard because I'm on my toes. Shoulders should be directly over your hand. And you're gonna push straight down. My hands are right because you don't be letting your person click.
I thought you said you had to have them like this.
You can, you don't have to do it like that. You can do it like this. Alright, so how fast? How fast did you go? What's the number? I ain't asking for the beat. I want to know the number. 100 to 120 beats per minute. That's how fast. And what's the song? What's the song?
That Beyonce song, the
Crazy in Love.
Crazy Love.
Or what's the one y'all too young to know? Staying Alive by the Bee Gees. By the Bee Gees, that's the name of the group. Oh, y'all poor souls.
They gonna know when they hear it. They don't know by name.
Yeah.
I'm the Chipmunk. And they be like,
Yeah, that's the Bee. That's originally that's the Bee Gees. Staying Alive.
That's how I know.
Yeah, that's the song.
They was in the woods.
So you gotta make sure that and you have to count out loud. Okay, so when you get ready to do your breath, what you do?
Tilt their chin.
So what's it called?
The head, chin lift. The head tilt, chin lift.
Head tilt, because you're tilting their head, you're lifting their chin, and you're gonna get 2 breaths, right? And then after the breath, what?
Start back to
Back to compression. So you do this 5 times, that should be 2 minutes, you're gonna switch out. Hopefully somebody got an AED. That's what y'all need. Okay? Alright. So we got to that point.
2. Check for a pulse.
So with the child, you're gonna check for a pulse. We said the carotid artery, that's on the side of the neck. Alright, femoral, we usually just check for the carotid. I guess if you can't get to it, femoral is like in your groin. You can check there. For an infant, we ain't got an infant yet. We're gonna talk about infants separately, but you'll feel their brachial artery. That's the one in their arm. So adult and pediatric is gonna be your carotid. Infant is gonna be the brachial artery in your arm. But we'll do the infant later.
Determine next action.
Alright, so we talked about this, if they're breathing, if they have a pulse and all that stuff. We know that.
At this point, the pediatric victim.
Alright. So, pediatric victim is in cardiac arrest. Oh, poor little fellow, look at him. Alright, cardiac arrest in a pediatric victim is a result of respiratory failure often. So, the victim's body was deprived of oxygen prior to the cardiac arrest. Thus, it is important for the lung rescue to immediately start CPR, which provides oxygen to the victim's body. So that's what we're saying. If you don't witness it, you don't know how long he's been down, you want to go ahead and get started because you want to give him some oxygen. Try to get the oxygen going. If the cardiac arrest is not the result of respiratory failure, such as in a sudden cardiac arrest, the victim likely has enough oxygen to meet the body's demands for a few minutes. So that is why you can go ahead and, if you've witnessed it, you can go ahead and get help first and then start.
Step 4. Witness.
Alright, so like we said, if you didn't witness the sudden collapse, you assume the respiratory arrest, or the arrest was a result of respiratory failure. So if you didn't witness it, that's what you're going to assume. And you're going to go ahead and get started. So that means they need oxygen, so you need to go ahead and start your CPR. If you did witness the sudden collapse of the victim, you're going to assume that it was not a result of respiratory failure, but heart-related, like with adults. So you'll go and activate the emergency response system and get an AD, and then start CPR.
Step 5.
So you'll perform high-quality pediatric CPR until an AD is available.
Perform high-quality pediatric CPR until an
All right, so generally the patient should not be moved. If their current position or location does not allow for effective CPR, move them as needed. So you want to make sure you got bulky clothes out of the way. You need to get their chest because remember, you can't put those AED pads on top of the clothes. It needs to be on bare skin. You can do compressions over clothing, but you don't want to. You need it to be open for the AED. All right, so you're going to perform chest compressions, rescue breaths at a ratio of 30-2. That's if you're by yourself. You should not stop chest compressions for longer than 10 seconds to give rescue breaths. Anytime you stop compressions, which should not be most of the time, no longer than 10 seconds. So you'll repeat the cycle, 30 compressions to 2 breaths until a valid reason to stop occurs. We talked about those reasons. After about 2 minutes, if still alone and not done, activate the emergency response system and retrieve the AED. So if you didn't witness it and you had to go ahead and start the CPR, after about 2 minutes and nobody's there to help you, you'll go activate EMS and you'll get an AED or try to get an AED, depending on where you're at when I have AED.
Step 6.
This needs to be chest compression. All right, so when the AED is available, it should be used immediately. So follow all the prompts. So of course we said no more thing to remember is to turn it on. You're gonna attach the pad. It's going to check for a shockable rhythm. So once you get it on and turned on and on the patient, you don't really have to do anything else but hit the shock button. If the heart rhythm is shockable, you're gonna deliver one shock. Remember, it's not gonna let you shock until it's time. So you can press that button all you want to, but it's not going to shock. I don't know, it might be somebody that did you wrong, but you want to save their life, and you still trying to hit the shock button. It's not gonna work. All right. After delivering a shock, or if the rhythm is not shockable, meaning they're in what? If it's not shockable, what rhythm are they in? Flat line, but it starts with an A. Oh, what?
I'm sorry.
Achilles?
Sicily.
No. A Sicily. A Sicily.
That's close.
Okay.
That's close.
So if it's not shockable, meaning they're in a Sicily, you're gonna immediately start CPR. So after about 2 minutes, the AED will request to check the rhythm again. While it's checking the heart's rhythm or delivering a shock, the rescuer should stop working on the victim and stand clear. So remember, you get ready to shock somebody, what's supposed to say?
Clear.
And don't be over here like, it used to be somebody was just like, clear. Nobody hear that. Like, when you're in a room with all these people, it'd be a lot going on. Like, he's like, clear. Man, you better shout so we can hear, because if I get shot, it's going to be me and you. You don't hit this button, and I'm over here touching this bed. So you got to say, everybody clear or something, allow them for everybody to hear.
So if a person gets shot, what's gonna happen to them?
It depends. Sometimes it don't do nothing, just like a little jolt. Sometimes it might knock them off their feet. I've never been shot with no hand on it.
They already dead.
What? No.
I'm just
We're talking about the healthcare worker, not the.
I'm talking about the patient now, but like
They dead.
if they're flatline and they dead, then you just keep going.
Yeah.
Bring it back.
Yeah. I mean, you're going to try. Now, if you're in the hospital, they're giving medicine, they're giving other stuff. So a lot of times the medicines will bring them back. Huh? You should go with Grey's Anatomy. You do give epi, but you also give atropine. So those medicines probably will, along with your AED, along with your chest compressions, will start a heartbeat. But the thing is, if it's just a medicine, it's not gonna last long. Cause then we'll be thinking we're done, and they'll call a code again, and here we go again. We're back in the room.
Step 7. Assist.
All right, so remember recovery position. So when they begin to show signs of return of spontaneous circulation, so that's coughing, crying, movement, you're gonna put them in the recovery position. So let me see if this will show the picture. Remember, that's the recovery
Assist to
position.
recovery position. When assisting an adult or child victim into a recovery, always follow local protocols. The following general procedure can be used.
Okay, so you're gonna place the
1.
arm
Place
closest to
the
you,
arm that
straight
is
out.
closest to you straight out from the body. 2. Bend the other arm across the chest with the back of the hand against the opposite cheek. Bend the victim's knee that is farthest from you. 4. Pull the knee toward you and roll the victim to the side. Be sure to protect the victim's head with your hand by keeping the head in line with the spine. 5. Tilt the head slightly upward on the back of the victim's hand. This will keep the airway open.
That's not long.
You said one page.
Oh, I forgot. I opened this up.
Step 7. Assist to
Okay. So you'll put them in the recovery position. For an infant, which we'll talk about when we get to infants, you'll put them face down over your forearm. So kind of like how you was asking. This is a big old infant, but this is how it'll be. So you'll put them face down.
Like a baby.
Yeah, a baby, not an adult. You're gonna make sure you hold the head slightly lower than the body. And y'all learn this when we talk about choking.
I got my little brother like that. Not my little brother, but he's a freshman now, but he was a premium.
Alright, you find an unresponsive child and you are the lone rescuer. How long should you perform CPR before activating EMS? Alright, you're gonna perform CPR for 2 minutes. So if you find somebody, that means you don't see anything, you don't know what happened, you just found an unresponsive child, you're gonna do CPR for 2 minutes, then you're gonna activate EMS. If the infant in infant recovery position, how is the head held? Lower than the body.
Lesson summary.
Alright, so this is same
What you'll learn
different,
during this lesson:
but your compression is going to be different.
working in a team.
Alright, so during an emergency, teamwork is critical to providing the highest level of care possible. Teamwork involves a group of people working together to achieve a common goal. In the case of cardiac arrest, that goal is to save a life. Elements of effective teamwork include understanding roles and responsibilities, good communication, and then performing debriefing. Debriefing is you talk about like what happened. Y'all might, if y'all play sports or something, y'all might talk about what went wrong during the game or what could have been better or something like that. Same thing. We could talk about like, we could have tried this or we should have done this or this wasn't working or something. So you debrief. You try to figure out solutions to the problem.
2-person pediatric.
All right. It's similar to the 2-person adult, 2-person pediatric. Same thing. Yes, it's similar. So we got the same steps: verify the scene, check for responsiveness, simultaneously check breathing and pulse, perform high quality CPR, attempt defibrillation, and then assist to recovery position. So it's the same. I gave y'all this flow sheet too.
Step 1. Verify.
Alright, so you're gonna verify the scene. So if the scene doesn't seem safe, you're gonna back off and alert the EMS. We know that. So if it's not safe, don't walk into it.
Step 2.
Check for responsiveness and activate EMS. So you're gonna tap them. Are you okay? You okay? With an infant, it's gonna be different. We'll go over that. Alright, so with 2 people, if the victim does not respond, one rescuer should activate the EMS appropriate to the setting and retrieve an AED. The other person is checking the pulse and breathing. So y'all find somebody down or somebody's down, y'all gonna get started. One person can run and call 911, get the AED, and the other person gonna start with the compressions and stuff.
Step 3.
So we know they gotta be supine or face up. Open the airway using head tilt, chin lift. If there's spinal trauma, you should do the jaw thrust. So you're gonna check for a pulse. You're gonna check for carotid artery. They also mentioned femoral artery, but on the infant, you'll do brachial. The same time you're checking for a pulse, you're checking for breathing. So you're gonna feel for a pulse and check for normal breathing for at least 5 seconds, but no longer than 10 seconds. You don't want to take too much time, because if you don't feel nothing in 10 seconds, then it's not there.
Determine next.
Alright, so we know the victim has a definite pulse and is breathing normally. You don't do CPR. Place the victim in the recovery position and monitor. You're going to reevaluate their pulse and breathing every 2 minutes. The victim has a definite pulse but no normal breathing. You're going to give one rescue breath every 2 to 3 seconds, or about 20 to 30 breaths per minute. Each breath should last about 1 second. So we talked about rescue breathing. So if the pulse decreases to 60 beats per minute or less with signs of poor perfusion, then you'll start CPR. So when you're evaluating them, if they have a pulse and they're breathing, but you got to watch them every 2 minutes. So if it decreases to 60 beats per minute or less, you're going to start CPR. So you're going to also look for signs of poor perfusion. So they might be cool, have cool extremities. They might be pale. They have patchy skin. Their appearance and turning blue. Alright, so after 2 minutes, if not already done, you're going to activate the emergency response system. If the victim lacks normal breathing and a pulse, the victim is in cardiac arrest, so you'll start CPR. No breathing, no pulse means CPR.
Step 4.
Alright, so we did all this. Y'all know all about making sure you have a bare chest for the AED. One person's going to do chest compressions. Second is going to give 2 rescue breaths after 15 chest compressions. So that's the change. When you got 2 people, for a pediatric patient or infant patient, it's going to be 15 compressions to 2 breaths instead of 30 to 2. You should still switch positions about every 2 minutes or 5 cycles to prevent fatigue from doing the compressions. Typically, this switch can be done when the AED is analyzing the heart rhythm. So when it's saying analyzing heart rhythm, y'all can switch. So you're going to repeat the CPR cycle, 15 compressions to 2 breaths until you have a valid reason to stop. Yeah, we talked about all those valid reasons already.
Step 5.
Alright, so when the AED is available, it should be used immediately. So first thing you need to do is to turn it on. So while one person is fooling with the AED, the other person is doing the chest compressions. So the AED will analyze the heart rhythm. If it's shockable, it'll give 1 shock. After delivering that shock, or if the rhythm is not shockable, meaning they're instantly, you're going to immediately start CPR again. When the AED is checking the heart's rhythm or delivering a shock, the rescuer should stop working on the victim and stand clear. So that's where you have to tell everybody to stay clear.
Step 6. Assist.
So you're going to assist to recovery position if the victim begins to show signs of return of spontaneous circulation or RA. So that's coughing, crying, movement. You're going to assist the victim to the recovery position. Alright, so with the child, you're going to do the same recovery position, but with the infant, you're going to put them face down over your forearm. You're going to support their head and neck with your hand, but you're going to keep the mouth and nose clear. You're going to hold the head slightly lower than the body. What's the ratio of compressions and rescue breaths during child CPR when there are multiple rescuers? 15 to 2. Anything more than 1 is going to be 15 to 2 for a pediatric patient.
Lesson summary. In this lesson,
So for the breath, you just
2 is going to always be 2 breaths.
like you just blow into their breath.
Yeah, it's like you, well, it depends on what you got. If you don't have anything to cover it, like a barrier device, back in the day, they used to do mouth to mouth, which they'll do head, tip, chin lift, pinch their nose, and put your mouth over their mouth.
It's cold. Yeah.
I wouldn't do it before COVID, so, I
What
mean,
you do then?
I got an ample bag.
What it don't work.
What if it don't work? Then I'm gonna do chest compression.
I'm saying like what if I just see somebody laying there in the middle of the road? Well, not in the middle, on the sidewalk, and then ain't nobody there yet, and I need to do breath. Then what?
You just gonna do chest compressions.
Oh.
I mean, unless you just want to put your mouth on people, go right ahead. Who am I to tell you to do that? That's your freedom, bro. That's your right. However, I say don't put your mouth on nobody you don't know. That's what I
Why
think.
you don't be doing them quizzes before grade no more?
I did. Y'all had a fit last week. That was the same quiz. That quiz
Oh,
y'all
yeah, it
took
was
was from the AES from here.
On quiz.
No, I was talking about, I know on quizzes, I'm talking about on there.
Because you know, in here the computer. I don't know. She wasn't here when they started the computers and they weren't working.
I don't think I was here either.
Somebody was here, but y'all was trying to log in the computer and the computers wasn't working.
Oh, the computer was working. It just ain't had any email.
Nah, just anyway.
They was trying to log in and it wouldn't. You know, I let like half of y'all log in and the rest of everybody could log in. So I ain't tried to do it again. But it's a that's where I got the quiz from. So be aware. More than likely, you're gonna have a quiz on pediatric BLS. Okay? So just be aware. I want y'all to be acting like I'm speaking Japanese, Italian, Japanese and Italian together.
Every time we got one.
Man, here, you got your shoes off, shoes.
Nope. Amazon.
I saw something like that with shoes. I'm gonna give me a pair. That's my outfit.
I'm gonna get them over there when they come in 2 days on Amazon.
I got some of that.
But they cheaper on shoes. What you pay for like what, 30? What same much?
25.
Oh, that's like 30
I got 2
something.
pair of shoes on shoes.
$31.
And
My mama caught a sale.
Hold on,
What's
what-
the sale on there?
Oh, where? Amazon? Amazon is my friend.
you got that Prime, don't you?
I do. I just got some yesterday.
I love me some Amazon. You get that UPS truck
I got my little tie-dye setup for tomorrow, and something else was in that bad box. I don't know. I stay with stuff in my car.
That's nice. And her shirt that you gonna make Friday.
I don't know, maybe
What you gonna make it
so now I need to make my own shirt.
No, just tell y'all.
All right, so we're gonna talk about Thursday. We're gonna go over high quality pediatric CPR and AED. I'm gonna let y'all practice. Probably go ahead and give y'all a rubric for it. I don't think they got one. And then remember Monday, I'm gonna let y'all do like a team dynamic thing, and y'all are going to do like a scenario with each other, and that's gonna be like a major grade. I gotta get y'all grades together. We missing a week and a half because we was stuck in one class.